And thank you for joining us today on this webinar. I am Erin Parker. I am the research director and one of our staff attorneys here at the Indigenous Food and Agriculture Initiative. And I'm glad to join you all this afternoon to talk a little bit about food and nutrition assistance here during this period of the COVID-19 crisis that we're all going through. So I'm going to give some updates and some impacts about that. And with that, we'll just get started if I can get my computer working. There we go. A little bit about us at IFAI in case you aren't familiar with us as an organization. We were founded in 2013 at the University of Arkansas School of Law by then Dean and now Vice Chancellor Stacy Leeds and our founding director Jamie Sims-Hipp. And then we moved with Vice Chancellor Leeds to the Office of Economic Development here at the University of Arkansas in July of 2018. And since our founding in 2013, our mission has really been to enhance health and wellness in tribal communities through work that advances healthy food systems, diversified economic development, and cultural food traditions all around Indian country. And what we like to say about our work is that we're putting the tribal sovereignty and food sovereignty, really focusing on everything that we do through the lens of tribal governance and tribal sovereignty and prioritizing that in food systems work as a way to do that empowerment of healthy food systems. And the way that we do that, all of our programs are providing strategic legal analysis and policy research all around Indian country food and ag. So we exist to be a free resource for tribal governments, tribal food producers, individual native farmers and ranchers, people doing food systems work, and change makers in Indian country food systems all across Indian country. So that's a little bit about us and some of the work that we do. And as part of that research and policy analysis, we are the research partner to the Native Farm Bill Coalition. And we have been that research partner since the organization was founded. A little bit about the Native Farm Bill Coalition. If you need some more information, there are over 170 member tribes represented in the Native Farm Bill Coalition. It was a group of tribes that came together to look at opportunities for change in the 2018 Farm Bill that would promote healthy food systems and economic development in Indian country through food and agriculture. By the time the 2018 Farm Bill was passed, there were 78 Native nations who had passed resolutions or sent letters of support, 15 intertribal organizations and Native organizations, including the National Association of Food Distribution Programs on Indian Reservations, which I'm going to mention a little bit in today's presentation as part of the work that we're doing. Whoops, sorry.
Hey, Erin, I wanted to just interrupt here really quickly. It may be a little bit of an error here showing your PowerPoint presentation. If you want to refresh here, I think we got a little bit behind on the slides.
Oh, sorry. What are you seeing right now?
We're just seeing just the presentation, or just the PowerPoint outline, not the actual slide. So if maybe need to play from start.
Okay, give me a second. Sorry, everybody. I am not a technical genius, so we will. Is that better?
Let's see if I can help you out here.
I hit play from start, so.
Yeah, let's go ahead. We can see the actual slide, so we'll try to help here and figure out how to get that full screen. But we can see the Native Farm Bill Coalition slide right now. Yes.
So you can just see the outline. It's not full screen.
Correct. Mm-hmm.
Okay. Let me just share my whole screen and maybe that will help. Does that help if I do that?
Yes. Okay, we are up to speed. Thank you so much.
Okay, cool. No worries. I definitely want to make sure everybody can see what is on my screen, which has gone away now. There we go. Okay. Sorry, folks. We'll jump back into it. So you can see just to clarify, you can see the membership screen for the Native Farm Bill Coalition slide now. We're all good.
Yes, we are good to go.
Perfect. Okay. So the Native Farm Bill Coalition, again, over 170 tribal nations represented, 15 intertribal and Native organizations represented, as well as some ally organizations, including Mazone, a Jewish Response to Hunger, and the National Sustainable Agriculture Coalition. And in our role as that research partner, one of the things that we've been doing recently is taking a look at some of the legislation and guidances and other federal authorities that have come out to support Indian country and people across the country during this COVID-19 crisis response. So there have been 3 bills passed by Congress, and if you were joining us a couple weeks ago on April 1st, we did a really thorough walkthrough of all 3 of those bills. I'm going to do a little bit of a recap here today. The ones that we're really going to focus on today are going to be the second two bills, the Families First Coronavirus Response Act and the CARES Act, the second and third bills that were passed, because those have a lot of the support for the food and nutrition programs that I'm going to be covering in today's webinar. But those three bills were all passed in March, one in early March, one in mid-March, and one towards the end of March. And there may be potential for a few more of those. We're kind of a wait and see sort of situation on that right now. In addition to that, of course, there was a national emergency presidential proclamation that happened on March 13th, 2020, and that triggered some authorities for USDA as well to be able to respond to this crisis. And there are several memoranda and guidances that have been put out by the Office of Management and Budget, which is within the Executive Office of the President as well. And I've cited the three that I tend to see most frequently as helping USDA have some of the authority to do the broad flexibility that I'm going to talk a lot about today when we talk about these nutrition programs and the way that they're operating. So with that, just a little bit of an update or a recap rather of those coronavirus response bills that have been passed so far by Congress. Again, the first one here is HR 6074, the Coronavirus Preparedness and Response Supplemental Appropriations Act. There's not a lot in here that's nutrition specific, so I'm not going to spend a lot of time recapping this one today. Just wanted to put out there that that was the first bill that was passed, and there is some tribal specific language in there. Most of that is $40 million going to tribes and tribal organizations, including urban Indian health organizations and health service providers to help do testing around coronavirus to respond to that. So that's a lot of what was going on in there. And there's some good links down here at the bottom to National Congress of American Indians, National Indian Health Board, and the CDC, looking at some of the requests from Indian country that happened around that particular bill. But Bill 2 and 3, again, are the two that really have a lot of the impact for the nutrition programs that I'm going to talk about today. So I'm going to spend a little bit more time walking through some of those things. This second bill, the Families First Coronavirus Response Act, which I'm just, for the rest of this presentation, going to call the Families First Act. So if I say Families First Act, I mean this piece of legislation right here, the second bill that was passed by Congress to respond to the COVID-19 crisis. And this had a lot of support and waiver flexibility for USDA in responding to this crisis around the nutrition programs that USDA operates. It also had some additional funding for those programs. So the WIC program, which offers support to women, infants, and children across the country, including 10% of people who participate in that program are American Indian and Alaska Native. So it's a significant program for Indian country for sure. There was $500 million in additional funding for WIC in the Families First Act. The Emergency Food Assistance Program, or TFAP, also got $400 million additional funding. The SNAP program, another critical part of the food safety net in Indian country, also had some eligibility for households who have students with national school lunch programs. That's pandemic EBT. It's how you may have heard that referred to. We'll go over that in a little bit more detail here in a few slides when we get to the SNAP program specifically. But that Families First Act did create that authority for USDA to be able to do that. There was also $64 million in that bill for Indian Health Service, and it also gave USDA as requested by state agencies, including tribes that are administering programs like WIC. There's a broad waiver authority, especially for WIC, that's in the Families First Coronavirus Response Act. And I'm going to go through in great detail a lot of the things that are in that that have come out of that act. The USDA has been kind of able to waive and make that program a little bit more flexible for people right now as we're trying to maintain social distancing and other things that limit the spread of the virus. In addition to that particular funding, there was also some additional funding through the Older Americans Act to help support American Indian, Alaska Native, and Native Hawaiian elders. There's $10 million in the Families First Act that supports the home delivery of foods to elders. So that was in there as well. I'm not going to go into a lot of detail about the Older American Act, but I wanted to make sure that that was highlighted today for sure. And then with the third bill, we get a little bit more funding. Specifically, the one that I wanted to talk about most today is going to be that $100 million that's in the CARES Act for the FDPIR program, the food distribution program on Indian reservations. That money is split evenly in the bill between $50 million for food purchasing and $50 million for facility improvements and upgrades. There was also additional support, again, for the Older Americans Act, this time for the Native American Nutrition Grants. There's $20 million in the CARES Act for that. SNAP, again, got some additional support in the CARES Act, $15.5 billion in the CARES Act to support additional SNAP funds during this time, and $8 billion for the child nutrition programs. So all of that is kind of where we are legislatively. That's what Congress has done so far. The CARES Act also, before I get into each nutrition program specifically, obviously, in order to have food to source for a lot of these nutrition programs, we've got to make sure that we're also supporting our farmers and the people who are growing that food. So there is some USDA specific money as well in the CARES Act for dairy, fruit, and vegetable growers, local food producers, and livestock producers. There's $9.5 billion in disaster funding there for those folks, and additional money to bolster the Commodity Credit Corporation, which is the big safety net fund that the USDA has and maintains, as well as some additional funds for the Broadband Reconnect Broadband Reconnect program, and the $25 million in telemedicine funding. So that's kind of where we are legislatively. That's what Congress has done so far. There's been a lot of funding support, as you see, for some of these nutrition programs, including FDPIR and SNAP and WIC. All of those programs have gotten additional monies over the course of these 3 bills to be able to serve additional people, especially something that's really, really crucial as people are finding themselves out of work when businesses are closing to respond to this crisis. So obviously that funding is going to be really important. But the thing that I really wanted to talk about a lot today, and the big update and takeaway that I hope everyone who's listening takes away from this webinar today, is there's a lot of administrative flexibility out there right now for these USDA programs that I'm going to talk about. This is a quote from the USDA Food and Nutrition Service that is on their website about waivers and flexibilities, and they say USDA intends to use all available program flexibilities and contingencies to serve our program participants across our 15 nutrition programs. And like that is the thing that I really want folks to take away from this today, is like, not only is there this additional funding that's out there that Congress has appropriated to make sure that we're supporting people and their ability to feed themselves and their families during this difficult time, but there's also this administrative flexibility that anybody in Indian country who is running one of these nutrition programs from USDA, whether that's WIC or FDPIR or CFSP, whatever those things are, between the 3 laws that have passed and those OMB guidances that have come out and the President's emergency declaration, USDA has some pretty broad authority to be able to waive and be flexible right now so that people can continue to make sure that our communities have food, but that they're also able to do that in a way that maintains social distancing, that protects the health of people who are high risk, whether those people are elders or immunocompromised folks. So the big takeaway I hope from today is that if you are somebody who's listening to this and you are administering a USDA program right now and there's something that you need in terms of program flexibility, USDA may be able to provide that right now. So I hope that you feel empowered to reach out to your regional office and ask for exactly what you need. If there's a rule that needs to be waived, USDA may have the authority right now to do that and to make that flexibility happen for you. So I'm going to go over some of the things that have happened in terms of flexibilities sort of by program right now. You know, USDA operates 15 different nutrition assistance programs. I'm not going to cover all 15 today because we would be here for 15 days probably spending a day on each of those programs. So I'm going to hit some of the big ones that I know are serving a lot of people in Indian country, that serve a lot of American Indian and Alaska Native people. So we're going to start with SNAP. So that's a significant part of the food safety net for American Indian and Alaska Native people. We know that there's over 500,000 American Indian and Alaska Native folks in the US who use SNAP every month to make sure that they're feeding themselves and their families. So that's a big piece of food security for American Indian and Alaska Native folks. So I wanted to start with that one. And as you can see, even in rural places where it is challenging to find a SNAP vendor, there's still a high amount of usage in Indian country of SNAP if you compare statewide versus tribal entities. This is a snapshot of an infographic that we have on our website. So if you want to see the whole thing, this is a SNAP infographic, and it's on our website at indigenousfoodandag.com. If you go to the resources section, you can download that there and check out the whole thing. But I wanted to put this visual up there just so you can kind of see some of the rates in comparison between states and tribal areas. And you can see there are some places where in tribal areas, the percent of people using SNAP is in excess of 10%. And that compares to state areas where it's much, much lower overall. So we know this is an important program for Indian country. And there is some SNAP flexibility and crisis response that has come out for USDA in some of the pieces of legislation that I covered, particularly the Families First Act. So the two big things here the three big things here for folks to know about are probably going to be the ABODS rule changes, pandemic EBT, and the emergency allotments or additional benefits for SNAP folks. In addition to those things, there are extended certification times. I believe people can be certified for up to 12 months now on SNAP. And there are some periodic reporting waivers as well for folks who are operating SNAP. That's only going to be state agencies for the most part. There are a couple of tribes as well that administer SNAP through state agencies. So just a good thing to know right now, some of those reporting things that people who run SNAP have to do, some of those are waived right now. There are extended certification times, and for anybody who has to do any kind of in-person interview, the USDA issued a blanket approval to do non-face-to-face interview basically. So if you need more details and you're running a SNAP program, definitely check in with your regional office, but those things have come out of the Families First Act to allow people who are running SNAP to keep supporting people who need the program, but also to do it in a way that protects them and protects their participants by allowing for more social distancing, doing things over the phone, doing things online, wherever possible to make sure that you're still serving folks, but doing so in a safe way. But those big things that I wanted to hit here that came out of the Families First Act, starting with the ABODS rule changes. So the USDA last year announced that they're going to make some changes to the rule for eligibility for SNAP for people who are able-bodied adults without dependents, or ABODs. The department's own estimates showed that this was going to remove about 700,000 people from the SNAP program when the rule went into effect. People wouldn't be able to use the program who fall into that category if they weren't able to meet the work requirements that USDA was adjusting as part of that. There's been a lot of controversy about that rule change. I'm not going to go into a lot of detail about that right now because that's another thing we could probably spend all day talking about, but I know there were some tribal organizations that opposed that rule change who wrote in during the notice and comment period when USDA released the proposed rule, opposing it as something that was going to negatively impact tribal communities in particular, where there's already high areas of unemployment. And after the rule, the final rule was published, there were a series of states that actually sued the U.S. Department of Agriculture to try to keep this rule from going into effect. So two different things happened around March 13th and March 17th that impact the way this rule is operating right now. It's not operating right now. It was supposed to go into effect on April 1st, 2020. It's not going into effect on April 1st, 2020. One thing, the first thing that happened was that those states that had sued the USDA trying to stop the rule from going into effect, did receive a preliminary injunction and nationwide stay for parts of the rule. And that happened on March 13th, 2020. There's an opinion, and it's in the notes to this presentation if you want to read the whole opinion, came out of the U.S. District Court for the District of Columbia. So there was already an injunction, a preliminary injunction that had happened on March 13th, 2020. And then about 5 days later, Congress passed the Families First Act. And in the Families First Act, that also officially pauses that rule. The Families First Act pauses it, I believe, until the Department of Health and Human Services declares that we're no longer in an emergency situation because of COVID-19, or June 30th, whichever comes first. So the act pauses it for a certain amount of time. I think arguably the district court's opinion is going to stay it for longer than that, while USDA and Department of Justice decide whether or not they're going to oppose that. I believe the initial idea was that they were going to oppose the injunction and continue to fight it out in court. So we're not really sure where that's going to go, but we know for right now, if you were concerned about that ABODS rule affecting folks in your community and their ability to use SNAP, know that that is paused under the Families First Act right now for sure. So that is currently not in effect. The second thing that came out of the Families First Act for SNAP that's going to be really important, I think, for folks is the opportunity to participate in something called pandemic EBT. This is for households, either whether or not they were already certified for SNAP. If households have at least one child who is eligible for free and reduced school lunch, and schools have been closed for at least 5 consecutive days, which all schools definitely have by now, then folks are eligible to participate in the pandemic EBT program, which is going to be an EBT card with some additional food support money on it to be able to purchase food to support those students who are out of school right now. There are only 9 states that are approved for that right now. That's Arizona, Kansas, Massachusetts, Michigan, Missouri, North Carolina, New York, Oregon, and Rhode Island. I am doing a little bit of exploration also right now just to make sure that this doesn't disqualify folks from participating in programs like FDPIR. I don't believe that it does. My understanding of this program is that it's not really a SNAP program per se. It's almost like an extension of National School Lunch, because the idea is to support children who are eligible for free or reduced school lunch through the National School Lunch program. Congress has just recognized that schools are closed. Obviously, it can be challenging for people to get to a summer feeding site if their schools participating in that. So this is just an additional way to help families during that time. So I don't believe that it disqualifies people from participating in FDPIR as well, but I know that has been a question that people have had. And then finally, from the Families First Act, another big thing that came out of that for SNAP is the emergency allotments, or basically this is additional benefits through SNAP. Once those are approved, or once a state agency applies to USDA to be able to do this, they are approved to be able to provide those additional benefits to everybody in their state who is on SNAP for up to 2 months. The act provides that if there are funds available and there's additional need in those states that have been approved to do this, that period could extend past that 2 months that's guaranteed. It's just going to depend on what funds are available and what the need is in each state. These can also be distributed once a month or spread out over a number of days. It's up to the state really and how they want to do that. If they've applied to USDA to be able to do that, the template form that you have to use if you're applying for it, you get to spell out whether or not you want to deliver the benefits all at once, those additional benefits, like when you're loading EBT cards. Normally, if you want to do it all at once or spread them out over a certain period of time, it just depends. The authority really there is up to the state to kind of work with FNS at USDA and tell them sort of what they want to do. And all of that is delivered via EBT card. That's not an in-person thing or a face-to-face requirement, I don't believe, to be able to do that, again, to promote social distancing, but help folks access additional benefits during this time when those additional benefits are very much needed. And there's a little bit more information from FNS that I've linked to here about that emergency allotment and some of the guidance that USDA has come out around that. In addition to the Families First Act, there's also some SNAP flexibility and crisis response from the existing regulations that give the Secretary of Agriculture some authority to provide some flexibility during this time as well. That includes phone interviews for anybody who's part of what administrating agencies have to do for SNAP is to do quality control checks and respond to quality control cases. And there's a little bit of authority in the existing SNAP regulations to allow the secretary to kind of relax those things right now. So that was one of the first things that USDA did once the World Health Organization declared that this COVID-19 crisis was a pandemic. USDA responded fairly immediately with that particular flexibility, so that is built into the regs and is a flexibility that exists right now, independent of the additional money and flexibility that's come through things like the CARES Act or the Families First Act. The CARES Act, again, also provided that $15.5 billion additional money for SNAP, since we are seeing, I know, some increases in people needing SNAP and similar programs right now. So there is additional funding out there as well for that. And then there's, what's on the horizon potentially for upcoming legislation. Obviously, I don't know what the future is going to hold for upcoming legislation at all, and I will come back to this for some Indian country specific considerations when we get to the second half of this presentation, which is going to kind of try to look forward to some of the asks that have come up from tribal organizations for future congressional responses to the COVID-19 crisis. But what I know for sure, if you look at some of the big anti-hunger organizations that are out there, like FRAC or Feeding America or Mazone, looking at a 15% increase in SNAP maximum benefits is one of the asks that I know that the anti-hunger community has had for SNAP, to be able to actually make sure that people are getting more in maximum benefits who are already on SNAP or who newly sign up for SNAP. They're also looking for a almost 50% increase in the minimum SNAP benefit, taking that minimum from $16 and bumping it up to $30, so that even folks who only qualify for that minimum amount are still getting a little bit more to be able to support themselves and their families right now. And they're also looking at asking for a suspension of SNAP rules that are weakening or ending benefits. So those are things that are similar to the ABODS kind of stuff. There have been several different rules that USDA had proposed over the course of the last year and a half or so that were going to limit the ability of some folks to get onto SNAP. So I think part of the ask from the anti-hunger community is looking at ways that legislatively Congress can kind of pause those things right now during this crisis, similar to what happened in the Families First Act with the ABODS rule. With that said, state agencies have been making requests for waivers on SNAP since this crisis started, really, and a lot of them have been approved. USDA hasn't approved every single one, so I did want to highlight that as well. There is a blanket denial letter that USDA issued on April 10th. There are some things that USDA didn't consider that they had the authority to do. So states were looking at trying to waive restrictions on students' eligibility, and that's looking at like college students' eligibility for SNAP, emergency allotments that exceed maximum benefits. Like, those are some of the things that USDA said that they didn't have authority to do and denied those requests. I think that's part of why you see the anti-hunger community looking forward and trying to increase maximum benefits right now, with USDA saying that they don't feel they have the authority to do this. So that's sort of where we are on SNAP. It's some of the authority that USDA has used to make things more flexible, and then there are some things that may require future legislative change to get those things addressed. So that's kind of where we are on SNAP right now. WIC is also a program that has received a lot of flexibility, particularly from the Families First Act, and also additional funding as well. We know that WIC, the full name of WIC, by the way, is the Special Supplemental Nutrition Program for Women, Infants, and Children. Now that you know that, you know why people just call it WIC. This is much shorter than saying all of those words. But WIC is a program that is really important in Indian country and for American Indian, Alaska Native people. 10.3% of WIC participants identify as American Indian or Alaska Native. There are over 700,000 American Indian, Alaska Native infants and children served through the WIC program in 2016, for example. So we know this is an important program for Indian country as well. And there has been a lot of flexibility for this program that USDA has right now. WIC has a lot of requirements. People have to be in person to get some of their benefits, sometimes including their vouchers or checks through the WIC program. People have to turn in medical documentation. People have to be physically present to do and provide lab work during this program. There's a lot of different regulations that govern the WIC program, and a lot of those are being waived right now by USDA for state agencies and tribes who administer WIC. There are tribal administration of WIC across the country, and what I've tried to do in the next couple of slides is sort of sum up the waiver flexibilities that USDA has already approved, just so that you know what's out there, and also try to highlight the tribes that already have those waivers, just so you know that those waivers are in existence right now. So bear with me. This is a lot of kind of crunchy legal language, but I think it's important just to highlight the authority that USDA has been able to use to make this program more flexible and promote social distancing while still allowing people to get the benefit of the food dollar support that WIC provides for women, infants, and children. So the first big one is the waiver of a physical presence requirement, and that includes the necessity of lab work right now. So normally the statute that created WIC, applicants for WIC, when they're applying for the program, have to be physically present if they're going to be certified, or if their time is running out and they're trying to be recertified for the program, they have to be there in person, and they also have to provide some lab work as well. The Families First Act allowed USDA to waive that. There are a lot of tribal nations with that waiver. I'm not going to read the whole list of tribal nations that have that waiver, but you can see that it goes all across the country in a lot of the different FNS regions. A lot of folks have requested and received that waiver. And if you want to know what those waivers look like, if you want to know what the response letters that you would receive when you get the waiver back from USDA, what those look like, they actually have them all on their website now. They've updated their coronavirus response website to have all of the information for not only states that have received waivers, but also tribal nations now. So all of those are online and you can actually check them out. So if you're looking to maybe reach out to your regional office to ask for a waiver and you kind of want to know what some of that language looks like, you can sort of see some of those letters and examples on USDA's coronavirus response page. In addition to waiving the physical presence requirement, there's also, normally in WIC, there's a requirement that participants have to be in person to pick up certain food instruments. Food instruments is a weird way of saying like a WIC voucher or a check. Those are things that count as food instruments for WIC. There are waivers in place right now, or the opportunity to request a waiver to do that remotely instead of having people actually having to come in, which is helpful for folks, not only in maintaining social distancing, but also helpful for people who may not have access to transportation right now to even come to their WIC office to pick up a voucher or a check. So there are some tribal nations that already have this waiver in place. Again, the Families First Act allows USDA to waive this. There's also some nutrition education contacts that people have to do if they're participating in WIC and before they pick up some of those checks, and that can be waived as well. USDA is encouraging people to reschedule those nutrition education instances if they have the opportunity to do that remotely, to do it that way, but that can also be waived right now. So that's another flexibility that's out there for WIC. The third one is a waiver of medical documentation requirements. Normally, the WIC regulations, WIC staff have to reach out and get medical documentation from participants' healthcare providers, and the Families First Act allowed that to be waived as well for up to 2 months for current WIC participants. That's only for current participants. It's not for anybody who's signing up now for the program, but if you have folks who are currently on WIC, there is a potential for flexibility in receiving those medical documents and kind of pausing that right now during this crisis. So there are some tribal nations who have that waiver as well. More waiver flexibilities. I told you there were a lot of them. I really did want to go over all of these because I think it's important just to kind of see the breadth of authority that USDA has to make access to WIC easier right now. So there's also a minimum stock waiver out there. WIC agencies are supposed to maintain certain stock items. Again, the Families First Act allows USDA to waive that. So that is out there as well. There's a waiver of separation of duties. Normally the regulations surrounding WIC, any one WIC staff person who's helping run the WIC program, that one person cannot really wear multiple hats. Basically, the regs say like it has to be different people doing things like determining eligibility, issuing those food instruments, issuing vouchers, anything like that for one participant. Different people are supposed to have that responsibility. The Families First Act waived that requirement, and there are tribal nations who have that waiver as well. So that separation of duties is something that can be waived too. If you're running a WIC program, you have folks on staff who are unable to be in the office because of the need to self-isolate if they're high risk or anything like that, there is a possibility to reach out to USDA and get that separation of duties waived, so that if you've got one person who has the ability to do that, who's in the office and can do those things, then that can keep the program running, and you still have that opportunity to maintain that social distancing and let other employees self-isolate if they need to. Food substitution waivers has also been a big one. So normally WIC foods, there's a specific list of foods that, and it's really by state or by tribe, that people who are participating in WIC are able to purchase with their WIC vouchers. There are some supply chain disruptions, though, that we know are happening around the country. It's been difficult for people to get the particular foods that they need, and that isn't an across the board problem. There are different foods that are out of stock in different jurisdictions, different locations. It really just depends on your supply chain. So I think as part of a recognition for that, the Families First Act also allows USDA to approve some substitutions for WIC right now. So for example, milk can be can be substituted. Participants can substitute milk of any available fat content despite the designation of their food package. That's something that USDA can approve right now. So there are tribal nations who have waivers around certain foods right now. Milk is a really common one that's getting waived. I think people being able to access the kind of milk that's normally required for WIC participants has been a challenge. So you see a lot of tribal nations with a milk waiver. Eggs is another one. Whole wheat and whole grain breads also have some substitutions out there. So you can, I actually went ahead and linked directly to the food package substitution waiver here. So if you're getting a copy of this presentation and you want to check it out and actually read through some of the things that have been substituted right now, if you're running a WIC program and you're having a challenge seeing your participants being able to source certain foods that they're normally required to have, know that there may be an opportunity for you to reach out to USDA and get that waived so that your participants are still able to access the program and feed their families during this time. But they may not be able, even if they're not able to find that particular food item that they're supposed to have, there may be a possibility to waive that so that they can continue to have that for their family, just a different product for now. So that's an opportunity as well for some flexibility in the WIC program. And finally, the last three things that we've seen that people have been successful in getting waivers for right now through WIC, local agency monitoring. Normally, WIC agencies have to go around and do on-site reviews of at least 20% of their local agencies or clinics. The Families First Act allows USDA to waive that requirement. I only found one tribal nation with this waiver right now. It's the Intertribal Council of Arizona's WIC program that has that waiver presently, but that is an opportunity under the Families First Act. So if that is a challenge for you right now, if you're running a WIC program, that flexibility exists, as does the flexibility to do direct distribution. There are some sites that are WIC agencies in Indian country that do direct distribution of foods. It's similar to FDPIR, and they do that for WIC. Normally, WIC participants get a voucher and they go to the store and they use their voucher to purchase food items. But in some places when people are very, very remote, there are very few programs that are able to do direct distribution just normally of foods through WIC. And the Families First Act gave USDA the authority to allow those sites to provide an additional month's distribution of some of their foods. And also when people are signing for their food, to be able to send a photo of a signature instead of doing a physical signature. So that's another option for folks if there are people who are doing direct distribution for WIC, to be able to provide that additional month so that people aren't having to find transportation to come and pick up that additional distribution during this particular time. That's a flexibility that's out there as well. And finally, there's some waivers that have been granted around compliance investigations for WIC. So normally the WIC regulations require that any agency running WIC conducts compliance investigations for at least 5% of the agency's vendors every single fiscal year. Obviously, that could be a challenge for folks right now trying to do any kind of compliance investigations during this crisis. So the Families First Act allows USDA to waive that as well. So 8 Northern Pueblos, a WIC program has a waiver for that. So that's another possibility. So these are just the waivers that have been granted, by the way. There may be more authority for USDA if you're running a WIC program or participating in a WIC program and there's something that would help you if the program can be more flexible. The Families First Act really gives USDA kind of broad authority to do a lot of waivers and flexibility for WIC right now. So if there's something that that you need, I would definitely feel empowered to reach out to your regional office, your FNS regional office, to ask for that flexibility right now, because all of these waivers have been granted already, and I do think that broad authority does exist for sure. So in addition to the WIC program, also the other child nutrition programs, which we know are very important for American Indian, Alaska Native children, also have some regulatory flexibility and waivers that have come out through the laws and guidances that have been passed already. There's some these are the programs like National School Lunch, National School Breakfast. We know that 68% of American Indian and Alaska Native children are eligible for free or reduced lunch, for example, and in rural areas, that's 72% of American Indian and Alaska Native children who are eligible for that program. These programs also have some regulatory flexibility right now. One of the first things USDA was able to do, even before some of the legislation was passed, was provide congregate meal waivers. So normally schools that are using like summer food or the seamless summer option through the National School Lunch Program, they have to provide those meals in a congregate setting or group setting, but USDA is able to waive that during a crisis so that people are able to do the kind of grab and go lunches that we're seeing around the country. And that has continued through the Families First Act. That is a nationwide waiver through the Families First Act through June 30th of 2020 to allow school meals to be able to continue, but to do so in a way that promotes social distancing. So you don't have to do group meals. People can do meal pickups. There's also mealtime service waiver and a meal pattern waiver that allows schools that are doing school feeding right now to do so in a way that allows them to substitute foods if they're not able to have foods in supply, and to provide meal times, or to provide meals at outside of normal meal times. So that's why you see a lot of schools are doing grab and go lunch and breakfast together. Instead of serving breakfast in the morning and lunch in the afternoon, they're able to package those meals together so families can come and pick those up and have them for their students in the morning, and just maintain that instead of doing two different services. And the Families First Act also provides for meal pickup waiver. I think initially when you saw a lot of school systems immediately responding to this crisis as our schools started to close, a lot of the programs that were out there required a student to be present for a parent or guardian to pick up meals for that student. The Families First Act provides a waiver for that, so that students do not have to be present if parents or guardians are picking up the meals. I will say the thing with that is, though, states have the option to opt into that. Basically, it is a nationwide waiver, but your state has to opt into it. I think most states have, if not all, but the state is still able to set some requirements for how the schools go about distributing meals. So even though that is a nationwide waiver, it may look a little bit different state by state as states are responding and using that flexibility. So if your state looks different from somebody else's state, that may be part of the reason why. If you want a little bit more information, by the way, about what school meal sites are right now and where they are and what the times for them are, there's a really good resource from FRAC that I linked to here. They actually have a national map and a resource library of all of the state websites with all of their lists of sites and times for meal pickup. So if you're looking for school meal information, that website's a really good resource, and wanted to make sure that I linked to that here. So I'm going to move on to FDPIR. Just trying to keep an eye on my time. So with FDPIR, if you were with us a couple of weeks ago for our webinar on April 1st, I talked a lot about FDPIR and the folks who use FDPIR every month and some of the things that we're seeing on the ground in FDPIR right now. I'm going to really briefly recap some of that, but want to get to some of the flexibilities that have come out of the CARES Act around FDPIR. So FDPIR or CMODS is a federal nutrition assistance program that gives actual food packages of folks to low-income families around Indian country and areas in Oklahoma. The food packages have frozen and canned food. They have grains and pasta, canned fruits and vegetables, as well as fresh fruits and vegetables. The fresh fruits and vegetable program has been part of the FDPIR food package since 2010. And FDPIR, there's about 276 tribes that use FDPIR. They're administered on the ground by 112 Indian tribal organizations and 3 state agencies. And you see about 90,000 people participating in FDPIR around the country every month. So one of the early things that the National Association of FDPIR was looking at asking USDA for early on was some administrative flexibility for ITOs in extending certification times and in delivering and pre-packing food service options. And those flexibilities do exist. That was one of the things that came up in some of the early calls with the National Association of Food Distribution Programs and USDA, that those administrative flexibilities are kind of built into what USDA could do without any additional change from Congress or anything like that. So those flexibilities exist. There were some concerns, though, from the National Association of FDPIR as the crisis really started to spread across Indian country, that like people are really concerned about having food at home. So FDPIR was seeing a rise in participation. It's about an 11% average rise in participation right now, that people were taking their maximum allotment of food instead of just usually people take kind of what they need. But people were taking the maximum allotment of their food package because they were seeing a lot of shortages in grocery stores, particularly in rural areas, and concerned about food availability long term. So understandably taking their maximum allotment to be able to make sure that they had that food for themselves and their families long term. Also, some initial supply chain inventory and ordering issues from the national warehouses were some things that the National Association was seeing, and just a lack of existing infrastructure to be able to handle new participants or just storage space to be able to have a space for additional food if we're seeing an 11% rise in participation across the country, with some sites seeing over 50% in the first couple of weeks of this crisis. So the CARES Act was pretty responsive to some of this, like just being able to see some of the data that FDPIR was able to collect through some of the surveys that FDPIR did of the ITOs that run FDPIR. Again, seeing that 11% average in new participants, 80% of FDPIR sites were reporting that their take rates of foods were increasing, which definitely impacts their individual inventory. There was 1 week towards the beginning of this crisis when FDPIR saw over 600 new households certified for the program, and that was just in 1 week. So there was definitely a high rate of usage. So the CARES Act does have some additional funding, as I mentioned, for FDPIR that really is designed to support some of those needs that we're seeing on the ground. And this is to prevent, prepare for, and respond to the coronavirus. It's $100 million, $50 million in additional food costs, and $50 million in infrastructure and or in facility improvement and equipment needs. I just call it infrastructure. That's essentially what that particular side of the money is. That's available till September 30, 2021, so the end of fiscal year 2021. That is the additional funding that's been provided for FDPIR and the CARES Act to be able to kind of address some of those issues that we're seeing on the ground initially. And I'm going to get into the specifics of that in a couple of slides. But one of the other reasons that I think this funding was so important was because a lot of Indian tribal organizations, when this crisis began, were looking at the possibility of participating in the Disaster Household Distribution Program, or the DHD. And the way that DHD works is related to FDPIR. Basically, if you have a FDPIR program, or you have any program that uses USDA foods, which would be CFSP, FDPIR, TFAP, those programs are allowed through disaster household distribution to use those USDA foods for additional households who are in need of food assistance. Whether or not they qualify for FDPIR, if you apply to your USDA FNS regional office to do disaster household distribution, you can use your FDPIR inventory to do DHD, and then FNS will reimburse you for the foods that you've used and replace them sometime probably in July, recognizing that there's a lot of strain on the national supply chain of USDA foods right now, but those will be replaced, and transportation costs can be reimbursed as well through the disaster household distribution program. But using that inventory that you're already using for increased participation in FDPIR definitely lowers the inventory that you may have on hand. So I think a lot of ITOs were kind of weighing their options and looking at their inventory, seeing how they could serve additional folks with the inventory that they had if they did decide to do DHD as well. But a little bit about DHD too, because I know there's been a lot of interest and questions about it since this crisis began. So you can use, if you apply to FNS to do disaster household distribution, tribes are eligible to do this. You can use the food that you already have in your FDPIR inventory to support households who are in need of food assistance. The way those food packages look is really determined by the ITO in partnership with FNS. So every single tribe that is doing disaster household distribution right now is going to be offering a different food package to those households that they are doing disaster household distribution for, because really what it hinges on is what the ITO wants to provide in terms of food and what they have in inventory to be able to provide not only food through DHD, but also maintain their FDPIR inventory for their FDPIR participants as well. So different ITOs are going to offer different options just because the ITO has the authority to decide what they want to offer based on what they have in inventory. That is subject to FNS approval. So there is a little bit of back and forth that I think has to go on when folks apply for when folks apply for disaster household distribution, there may be some back and forth with USDA as to what they propose to offer and what USDA ultimately approves. But like, for example, USDA is not approving frozen foods for DHD. So if you fill that out and you propose to do frozen foods for DHD, they're probably not going to approve that part of it. But really it's up to the ITO when you fill out the form for disaster household distribution to determine what you want to provide and in what quantities you want to provide. And you make that determination based on what's in your inventory. Households don't have to qualify for FDPIR or any other federal nutrition program to receive disaster household distribution. This really is like an emergency program designed to help people in times that we're having, like exactly the times we're having right now, where people are suddenly out of work and not really sure how they're going to continue to put food on the table. So there's not a qualification or certification for FDPIR that they would have to go through or anything like that. This is just something that once you're approved to provide it, people can come in and pick up this food. If you're interested in applying for it, there are about 20 tribes that have applied and been approved for it so far. You apply through your FNS regional office, and they have a template form that you fill out. It's pretty quick. All the information on that form, if you're curious, it comes from the regulations, and I've cited to them here. Basically, you're just asked to tell USDA when you want to start and when you want to stop doing disaster household distribution. You want to provide a brief description of the need in disaster, which is a pretty simple ask right now for sure. The approximate number of people you want to be served, that you want to be serving, the approximate quantity of food that you're going to use to do that, and the type of food that you're going to use to do that. Specifically, like specific food groups, like how many cans of vegetables or how many cans of meat, et cetera, that you want to provide as part of that distribution, and then the number and location of distribution sites, and that's it. It's like a 2-page form. It's pretty simple to fill it out and send that into the regional office. So if this is something that you're interested in doing and you feel like you have the inventory capacity in your warehouse right now to continue to provide your FDPIR service, but also provide this for additional families in your community who may need some help right now, this is definitely an option for you to be able to do that. And just kind of the way this works, like everybody at FNS is involved in this. Like you apply to the FNS regional office, but that request actually goes up to headquarters in DC. So basically, like it starts with the tribe. Like you would determine what needs you have, what foods you want to provide, send in that 2-page template form to your regional office. The regional office looks at it. They can review your request and suggest any changes. They send that to FNS headquarters. FNS headquarters does the similar situation and then provides the approval to the regional office, who then provides it back to you and says, green light, you're good to start disaster household distribution. So that's sort of the way that works. And again, there are about 20 tribes who are participating in that right now. You can see all those folks here on the screen. USDA does maintain a website now with the tribal nations and the states that are participating in disaster household distribution. So as that changes, I would definitely check their coronavirus update page, because you can see as additional tribes and states are added. But these are the states and tribes that are participating now. So those are all of the programs that I'm going to cover today. There are definitely more food assistance programs out there that USDA manages. Again, they manage 15 programs, but I really wanted to hit some of the ones that I know are questions that we are currently receiving from folks right now, and some of the programs that provide really serious food safety net support to Indian country right now. So again, just the big takeaway here, there is administrative flexibility through the Presidential Emergency Declaration, the OMB guidances, and the legislation that Congress has already produced that give USDA a really broad authority to help out. Sometimes that may be on a case-by-case basis, but I really hope that people feel empowered to reach out to their regional offices with what they need right now. If there's an additional flexibility that I didn't cover, that I didn't mention, or a program that you run that I didn't mention today that you need flexibility on, like you have the authority and the power to reach out to USDA and say, like, tell them what you need. And you do that again through your regional office. But if you are not getting a good response or you run into any problems, please reach out to us. My email is going to be at the end of this presentation. I would be more than happy to help in any way that I can, as well as USDA's Office of Tribal Relations. I put their number here on the screen. If you're trying to make a request to a regional office for flexibility during this time and you're running into problems, like please reach out to me, but also please reach out to the Office of Tribal Relations. Like their whole mission is to make sure that they're supporting Indian country now and always. So please definitely loop them in as well if you're having any trouble getting some kind of flexibility for the nutrition programs that you're already using or running. So really, really fast. I know I wanted to leave some time for questions and I've talked a lot. The Native Farm Coalition, again, in our role as the research partner, we've been kind of keeping an eye on the legislation that's come out that's supporting Indian country through this crisis, but also the implementation of that legislation we know is really important. So we keep monitoring the implementation of the FDPIR funding, the 100 million that was allocated for FDPIR in the CARES Act. Just a couple of quick updates. If you joined us on our April 1st webinar, you've heard some of this, but I wanted to provide you with a little bit of an update on what's happened in the last 2 weeks. So one of the priorities for the Native Farm Coalition for FDPIR and that funding was to expedite the process to get funds to sites. USDA is working on it. It may go through the regional offices. FDPIR, the board has asked to be looped into that process and be an integral part of that process, sort of a monitoring role. And so hopefully we'll have another update on that soon, but that's kind of where we are right now. The funds haven't yet been dispersed to sites for the equipment and infrastructure funding that was in the bill. So we're keeping an eye on that, but there is I think a process that's starting to be developed at USDA for that. FDPIR supplemental funds, to confirm that those would be used immediately. Again, still working on that one with USDA. Those funds are available till the end of fiscal year 2021. There is a possibility that the funds are going to be able to be used to cover administrative costs, the ones that are not needed to purchase additional food. That certainly would ensure that those funds are utilized immediately, and we know that's really important. We do still need some progress on the possibility of waiving the non-federal cost share for FDPIR right now. That's a really big, important one. We know as tribes are struggling with funding streams being closed off right now in response to this crisis, being able to use some of those funds to waive that non-federal cost share and keep programs operational without additional matching funds from tribes would be really important. And would also be a way to ensure that the funds are used immediately to help Indian country. So still waiting on some progress there, as well as the 638 authority that was in the 2018 Farm Bill. USDA is exploring the possibility under current authorities of doing local and regional food procurement by ITOs. It may or may not need legislative action, just kind of working through that with them at this point. And finally, just the calls with USDA are continuing every week. We have a check-in call with the National Association of FDPIR, FNS folks, tribal leaders, to talk about the implementation of this, and also just check in on national warehouse inventory and any new issues that arise. So that is ongoing. As we look into the future to see what might be coming from Congress in coronavirus response bills 4 and/or 5, we're not really sure what anything looks like right now. Some of the stakeholder input and ideas that we've gotten and seen through the Native Farm Bill Coalition have been like allowing dual participation temporarily in FDPIR and SNAP to kind of ease the burden on both of those programs and make sure that people are able to provide food for their families during this difficult time. Like, we know that there's been issues with folks in rural areas being able to actually access foods that they need. Food availability in grocery stores has been difficult. We know there's been some price gouging in grocery stores in really rural areas, especially for fresh fruits and vegetables right now. So being able to ease that burden and let people make sure that they're having healthy options to feed their families right now is really important, and allowing that dual participation temporarily in both of those programs would certainly help. FDPIR, to be able to use the FDPIR CARES Act funding for administrative costs and waive that federal cost share requirement is another potential idea for future bills, as well as doing local and regional food procurement with FDPIR. And finally, of course, including tribal parity in the TFAP program, since tribes are not currently able to administer TFAP. The input and idea on that has been to have that tribes included in that. So that is kind of where we are with food and nutrition programs right now. I wanted to direct folks definitely to keep an eye on our coronavirus update page, indigenousfoodandag.com/COVID-19. That's our resource webpage. We cover a lot of different topics, and we provide updates as soon as we can on things that are related to COVID-19 and this crisis. So with that, I think that is finally all my slides. I know I talked a little bit longer than I intended to, but I wanted to make sure I got through all that waiver information about WIC, because I think that flexibility is really important to see. I've highlighted my email address here on the screen. So if you have any questions that you don't feel comfortable asking during our question and answer period, or if you think of something later, or you have a problem and you need to reach out to me, please email me anytime. We're all working from home right now, so email is probably the best way to get me, just because I've definitely always got my my inbox on my phone or wherever I happen to be. So thank you so much for joining us today. If anybody has any questions, I would love to try to answer them. I think, yeah, that's it.
Thank you for that. I will jump in. We have one question that maybe we have time for to cover, and we will be sure to also follow up with some of these questions individually after the webinar as well. Can you expand on if there are any efforts to get FDPIR up and running in communities that are not currently administering FDPIR?
That's a really good question. I don't personally know of any, but I mean, I know that with that additional funding in the CARES Act, certainly there would be that opportunity for support in communities that don't have that program right now. I think it would, certainly there would be some challenges to work through getting that set up long distance and trying to make sure that you're maintaining social distancing and everything like that during this particular time. But I would, if you can share your contact information with me, I can put you in touch with I'm not sure who asked that question, sorry, so I don't want to.
Yeah, I will absolutely connect you with one.
Yeah, I can connect you with the National Association of Food Distribution folks and see what we can get going there.
Okay, and I think that is all of the questions we have right now. But again, as Erin mentioned, you can find our contact information here on the slide. It's also available on our website at indigenousfoodandag.com. We will follow up with an email that includes this webinar recording, as well as this presentation. And if there are not any more questions, I think that we can close out there. But thank you so much, Erin, for this great presentation today.
Thanks, everybody.
Thank you.